All right, here you go. Welcome, folks. You should be seeing my lead screen here now that says the truth about lower back pain and sciatica. And so I really appreciate you sharing some time of your precious time with me tonight. Back in the day, and still sometimes times yet today, we do in-person workshops. Those are really nice because you can see each other eye to eye. You can see my eyes, but I can't see your eyes tonight. So that's just a little bit different. But we're going to do our best to remain as interactive as we possibly can tonight. So if you do have any questions at any time, just click the chat button at the bottom of your screen. That'll give you a little field you can write a question or a comment into. I'm going to keep track of those throughout tonight, and I'm going to do my best to respond to as many of those as I can tonight. Sometimes it's hard, though, as I'm sharing information and lots of people are responding. So if I don't get to it during our workshop tonight, I will certainly reach back out to you to make sure any of your questions are answered. I'm also going to share with you my contact information where you can get a hold of me directly if you choose to do it that way too. Why in the world would you want to listen to me? Well, let me tell you just a little bit about myself. I've been doing this for a long time. I got to do the math now. It says 27 years of experience. I got done in with PT school at the University of Iowa in 1996. So going on my 28th year later this year, it'd be 28 years of experience as a physical therapist. I've been doing this mostly in outpatient musculoskeletal environments, and lower back pain is the most common thing that I see over and over and over again. My company, Work Systems Rehab, is now known as Kinetic Edge Physical Therapy. We've been around for over 25 years. We have 8 clinics in central and south central Iowa. And as I said, lower back pain is really common and we see a lot of it. So what you're going to learn tonight, what I'm going to share with you tonight, is based upon my nearly 28 years of experience of working with tons and tons of people with this problem. And it's also the shared experience of the 50 rehab physical therapists and movement professionals at Kinetic Edge Physical Therapy. I forget the math. Once upon a time, I did the math. I think we had something like over a 3-year time period, nearly 40,000 treatment sessions within our practice on people with lower back pain. So it's inevitable that you learn a little bit about this condition. There are certainly unique attributes in every individual, but there are also a lot of common patterns. We're going to talk about those patterns tonight. One of the things I want to also share with you is our approach at assessing and then helping you get through this issue if you have lower back pain. We do what's called 3D maps, three-dimensional movement analysis and performance. There's a time to spend on the table, on the treatment table, and there's some hands-on things that we do in that setting. But ultimately, it's about getting you back on your feet between gravity and the ground and moving three-dimensionally and making sure that every link in your movement chain is doing what it was designed to do. That is the most important thing to help you be well again. So we're going to spend some time talking about that tonight. You might be sitting here thinking, boy, did I make the right choice? Is this the right place for me? Well, let me clarify and qualify you for this here tonight. So many people that I've worked with over the years come and see me, in some cases, almost as a last resort. People that have tried so many different things, spent a lot of time, energy, and money on things that they hoped were going to be solutions. All the while, over time, it tends to get worse and worse and worse. And people get concerned that I might not be able to do what I want to be able to do. Maybe you're already there yourselves. As people and as Americans, we're used to being independent. We don't like being dependent on others. And so if you find yourself being concerned that because of your back issue that's progressing over time, that you're maybe going to become more dependent upon others, this is the perfect place for you to be. I get a lot of questions. The biggest question I get is, what can I do to make it go away? Or will it ever go away? And some of you might be to the point where you're even saying, do I need a surgery? I wouldn't even be surprised if some of you on here have already had back surgeries tonight and you're still having difficulties. And so if you've been asking tough questions about what you can do for your back, if you've been searching and not finding answers, this is a great workshop for you. Some of the people that I work with are fearful of moving a certain way. They're fearful of moving at all because in case they move the wrong way, it can catch them really quickly and really badly. And I want to take away your fear of moving by teaching you what it requires to move well. So if you're fearful of movement, this is a great workshop for you. And if you just don't know what to do, you don't know where to turn, you feel lost, if you feel like your back pain is having a bigger impact on your relationships, on your overall health, this is a good place for you to be. One of the truths we're going to talk about tonight is the fact that your back doesn't exist in a vacuum. It's connected to other things. It's in community with other things. And I'll give you a little snippet of a truth we're going to go into more deeply in a little bit. But the problem with most back treatments is that they're focused on the back. That sounds kind of funny, right? My back hurts, you should be focused on my back. But your back does not exist in a vacuum. Your back is influenced by the closest neighbors. And if you ignore the neighbors, you're going to ignore potentially a major cause or several causes of these issues. And this is true with us too. We influence those around us, those that are closest to us, for better or worse. And we are influenced by those who are closest to us for better or worse. And so your back needs really good neighbors to function well. And if you are feeling well, you have a better chance of being a positive influence on those closest to you too. So we're going to play into that a little bit. Now, if you were hoping to learn, there's one trick, one solution, one exercise, one pill, one whatever to make this go away, I'm sorry to tell you this is not the workshop that's going to do that for you. And it's not going to do that because it doesn't exist. There is not a silver bullet solution for eliminating back pain. But we are going to talk about how to get to the real root of the problem. And it's not always simple, but it's kind of easy. And you'll learn a little bit more about that tonight as well. And the best part is you're going to learn how to do these things without requiring medications, injections, and surgeries, hopefully. So if you're just looking for that quick fix, I can't give it to you. I don't want you to mask your symptoms anymore. I want you to be able to find and fix the root of the problem. That's who this is for. Now, I'm going to ask for your interaction just a little bit here tonight, folks. If you could, please, I want you just to hit that chat button again. So let's be a little bit interactive. I think if you hit it and send it, it only comes to me. I don't think other people can see it. So I want you to answer this question. Is there a specific activity that if you do this, you know it's going to hurt worse? Is there something that you do that makes you hurt worse? Tell me what that activity is. Then if you care to, you can answer those other two questions too. How bad does the pain get on the 1 to 10 scale? There's nothing worse than 10. So that's something we see from time to time. But 10 is, I need to get to the emergency room immediately kind of pain. So how bad does it get on the 1 to 10 scale? And then how long have you been dealing with this issue? Now, the answer to those last two questions, how high does the pain get and how long you've experienced it, that doesn't let me know if I can help you with what we're going to talk about tonight, but it might be a predictor of some sorts as to how much time it's going to take to make it go away. If it's more significant pain that's been around for a longer period of time, this cumulative process that we're going to talk about is probably a little bit more advanced. It takes a little more cumulative effort to make it go away. But the one thing I can tell you for sure is if there is a specific activity that you say, if I do this, I know it's going to hurt me. This is actually kind of good information in a weird way. Here's a saying I want you to understand. If your pain is reproducible, then we also know it's reducible. So let me say that again. If it's reproducible, it's reducible. So I put what I got here, about 10 things. So if you've had these issues, these are the things I hear all the time. There are some positional complaints. It's either walking or standing, or in some cases it's sitting, bending and or twisting. Putting on my shoes, I can really feel it. That's a kind of a bend and twist comment, actually. Working, sleeping, raking, shoveling, those are the things. There are physical, functional demands that make this worse. I'm here to tell you, if you can tell me, yeah, it really hurts when I stand. It's not as bad when I sit. Or if it's vice versa, it really hurts when I sit, but I can stand and feel pretty decent. If there's something that brings it on, if that specific activity is something that reproduces your pain in a weird way, it's good news, because if it's reproducible, it's also reducible. To better understand that, I want you to understand trauma. So when you hear the word trauma, what comes to your mind? What do you think of when you hear that particular word? If you're like most people, when you hear the word trauma, you think big and bad, motor vehicle accident or a fall from a height. We think of major damage to our tissues when we hear the word trauma. And that's true of some traumas. That kind of trauma is called acute trauma. And so this graph that I have here on the right side of my screen, this is tissue damage over time. How bad or severe is the tissue damage and the time it takes to deal with it. With acute trauma, this is what it looks like. Sudden tissue damage, and then over time, it slowly gets better. Here's the good news. We're humans. We're organic beings, and we are made to heal. And with acute trauma, because it comes on suddenly, it is typically the result of a single stressor, a major physical stress. And that creates sudden and severe tissue damage that hurts. It immediately gets above the symptom threshold. But because we are made to heal over time, it gets a little bit better. And in most cases, unless it's really, really substantial trauma, at some point in time, we're going to get down below that symptom threshold again. That's acute trauma, and it's a real thing. And I see it with the clients that I serve in our clinic. It's not the most common type of trauma that we deal with, though. The most common type, far and away, is cumulative trauma. As opposed to acute trauma, which comes on really suddenly because of one major stress, cumulative trauma is much more insidious. It doesn't come on suddenly, it's slowly progressing. The changes in the tissue are gradual and progressive and take time. And what you just saw with that gradual upslope on that arrow was just a few seconds on your screen, but it could take months or years before we get across that symptom threshold. Some key points about that. There are things changing in our body before we feel it, okay? And then once we feel it, once we get above that symptom threshold, usually people are going to tell me at that point, it's not bad. It's a little uncomfortable and it's not there all the time. I can deal with it. It's fine. But we continue to expose ourselves to these stressors over time, and the symptoms get worse. They become more frequent, more intense, longer in duration. Why in the world do I have those two buckets on there? Well, I want to give you this analogy that kind of works for me. If you're a visual learner, I think this makes sense. Cumulative trauma, I said, is slow, gradual, insidious, but it's also somewhat predictable, actually quite predictable. When the body's tissue changes, there are signs and symptoms that we notice. The first thing that we typically notice when we got a little water in our bucket is fatigue. Now, I am 52 years old. I've been a physical therapist for over half my life. I don't know what you do, but I'll tell you this. Physical therapy is not the most physically demanding work. I'm not lifting heavy things. I'm not in terribly awkward positions. I'm not exposed to a lot of force, time, and motion like some occupations require of people. Even so, over time, my body is changing. My tissues are changing. I can tell you that by the end of the day and by the end of the week, I have more fatigue today than I had 25 years ago because I'm changing. Some water is filling my bucket. And most people, myself included, recognize that's kind of normal. We're not going to last forever. We do wear out. Age does catch up with us. And so we kind of slough it off. That's normal. So we just keep doing the same things. More water fills our bucket. And eventually, that which was originally just some fatigue, tiredness, changes. It becomes a little worse. Now it's becoming uncomfortable. Okay, so discomfort, it's not true pain, but it's not quite the same. Lots of people will use words like, I'm a little stiff, I'm a little sore from time to time. I can tell my tissues are changing. And again, most people can rationalize that away. It's not that bad. We don't like to be squeaky wheels. So we just kind of put our head down and keep going and keep going and keep going. And more water fills our bucket. And as fatigue gave way to discomfort, eventually for many people, discomfort with enough time and accumulation gives way to pain. Now, pain is different than discomfort. It's not just a little stiff or sore. It hurts. Okay, it's a different level of severity. And you're pretty close to this final level. When it overflows, that's when we have true tissue damage that definitely takes more time to overcome. So our goal with what I'm teaching tonight is to recognize what we can do to open the valve, get a little water out of there, and make sure we've got some gap between the top of our bucket and the top of our water. That's everything we're talking about tonight. So all those things from fatigue to discomfort to pain are signs that the cumulative issue is worsening. And if you listened closely a couple slides ago, I talked about the nature of that pain as we accumulate stress over time means that it will become more frequent, more intense, and longer in duration. That's the path that we're on if we don't change courses. Look at my screen here. The backdrop is an old railroad track, and if you look carefully on the horizon, you will see evidence of a train rounding the bend, and you are in the middle of the track. That's not good. Some bad stuff can happen. Now, it isn't just suddenly the train's there and we're in trouble. We hear signs, we see signs, we recognize it's coming. We are being warned about this issue, and hopefully that allows us to get off the track soon enough to be kept safe. Okay, so I want you to recognize the signs and symptoms of cumulative trauma so that we can actually do something about it. And this is more than just feeling better at your back, although that's really important. When we hurt, we don't move as much. And when we don't move as much, that's not good for us, specifically at the back and generally with our overall health. In America, I think the statistic is 86% of our healthcare dollars are spent on 6 things. Heart disease, first and foremost, most significantly, certainly is musculoskeletal issues. That is the #1 healthcare spend in America. But aside from musculoskeletal issues, we have heart disease, cancer, diabetes, obesity, and depression. Those are the top 6 things. What's interesting about that is 5 out of those 6 things, musculoskeletal issues, heart disease, diabetes, obesity, and depression, are all positively impacted by good and regular movement and negatively impacted by poor and less significant or less common movement. And so my goal is to help you move better so your back feels better, but also so that you're generally moving better, which helps your overall health, leading to fewer doctor visits and less medications, fewer surgeries. This is more than just back pain. This is about your overall health. Now, most of the time when people are originally presented with a problem, especially if it seems like it's relatively minor, the natural response is we tend to ignore it. I've already alluded to that a few times here tonight. About 9 years ago, I bought a home that was built in 1915. It was 100 years old when we bought it. And it had been renovated and some good stuff. It's a solid structural home. But when we moved in, we brought the insurance guy over to take a look at it to get it insured. And he said, yeah, it's good. We'll cover everything except for that roof. You need new shingles. And it was a big home, big old home. And I knew it wasn't going to be cheap to change those shingles. And so I went inside and I looked around. I'm like, okay, that's not too bad. I'm fine. Eventually I'll get this done. And I ignored what I was told was a problem. Now I'm happy to report I did not have major issues, but if I continued too long in ignoring a present problem and didn't fix it, I was probably going to have a cost more substantial than just changing those darn shingles. Okay. But this is human nature. If it's a smaller problem with less perceived issues, we tend to ignore it. It's the single greatest problem that people make, biggest mistake that people make with regard to a back-related or any musculoskeletal problem. And I say that because early on, when the issue is more minor, it's much easier to treat. It goes away much more quickly. You're not in category 1 anymore because you're here listening to me. You're no longer ignoring it. You're wanting to do something about it. Unfortunately, most of the solutions for lower back pain and any musculoskeletal issues are not really true solutions. Most of the things that we're told will help us don't really get to the root of the problem. It just masks the problem. We alter it in some way, shape, or form. And I'm here to say, even in the medical field of physical therapy, to some degree, I feel like I need to apologize because ultrasound and electrical stimulation, all those things, they do not fix the root of the problem. Now, don't hear what I'm not saying. It's okay to do something to feel better, and occasionally we'll do some of those things. But getting you better is not about just feeling better, because feeling better is temporary. If you don't get to the root of the problem's going to rear its ugly head again. And so tonight I want to talk to you about what you can do to truly solve the problem? How can we get to the root and uproot it entirely? That's what we're going to do. Now, I want you to understand this one key point before we move into the most important topic of tonight. We're going to talk about the difference between medical issues and mechanical issues. And I think a big problem with musculoskeletal related problems is that most of the people in the medical field view it as a medical problem. And that on its surface would seem to make sense, right? If you were to be told, well, yes, your back problem is a medical problem, that seems understandable. But I'm here to tell you tonight, it's not as much a medical problem as is it a mechanical issue. So let me give you an example. If you're driving down the road on a beautiful spring day, 70 degrees out, you got a convertible, so the top's down, and you're just enjoying a leisurely ride on the perfect day. And all of a sudden, a light comes on your dashboard. Okay. Now, if you're like me, okay, ignore the problem. You can't trust that light. It's come on before. It's not an issue. I'm going to keep enjoying this day. And maybe you'll be fine, but maybe not. If it is a real issue you're being alerted to, it's not just a bad sensor. Eventually, that light that came on is going to be accompanied by other issues. You might start to smell a little smoke, see a little smoke, hear a little rattle. And when those things start to occur, obviously we're going to pull off on the side of the road and we're going to pop that hood and take a look at what's going on. Now, let's imagine you do this. You pop the hood and you also pop the trunk, because you know in the trunk you got this big old piece of thick foam. And so you cut that foam just to the size of that engine block, because the noise and the smoke and all that's coming from the engine. So what we're going to do is we're going to put that foam right on top of that engine block. We're just going to cover it up, and then we're going to slam that hood shut. And then you're going to go into your glove box of your car, because you know in your glove box you got a duct tape in there. You're going to take a piece of that duct tape and you're going to put that duct tape right over that light on your dashboard. See no evil, hear no evil, smell no evil. Problem solved, right? No, just getting rid of the signs, just getting rid of the things that make you aware of it does not fix the problem. It just means you don't hear it anymore. You don't lift up your shirt and look back there and there's a dial that says, well, look at that, I'm low on ibuprofen. I just better take some anti-inflammatories and I'm going to be better. That'll get me up into that safe zone with my anti-inflammatory benefit. You cannot successfully manage a biomechanical problem with a biochemistry treatment. These are issues of movement in almost every case. And remember, we talked about if there's something you do that makes you hurt worse, there's a movement that's putting stress on a tissue. So the key is, how can we move better so that we can do what we want to do without putting stress on that tissue? That's not a medical issue, that's a mechanical issue. It's a movement-based problem that needs a movement-based solution. That's what we're going to talk about tonight. And again, I don't want to go deep into the weeds with this, but when you're told that something's inflamed, we are naturally conditioned to say, hey, I can do something about that. That inflammation needs to be dealt with, and I can do that with an anti-inflammatory in some way, shape, or form. But I want you to understand this. You see these 4 phases of healing? Every tissue that has damage is going to go through this healing, ideally. See what phase 2 is called? From day 3 to about the end of week 3, after we irritate or damage some tissue, it goes through inflammation. So I want you to understand this. Inflammation is a normal part of the healing process. Inflammation is a phase that helps us get to the later phases like proliferation and maturation. In the inflammatory phase, the body's preparing a framework for vascular growth. And as that matures over time, it proliferates and gets more significant and eventually matures. And we have tissues that go through that full process that have this matrix of vasculature that brings blood and therefore nutrients to the tissue. Okay, we want that to occur. We need that to occur because those tissues are only going to be healthy if they get and continue to receive the nutrients they need to be healthy. And so C.S. Lewis, one of my favorite authors, has been gone for a long time. He wrote an essay during World War II. I think it's called Miracles, maybe. I can't remember exactly. But in that essay, he wrote, the magic is not in the medicine, it's in the human body. And if you're going to do a treatment that's effective, I'm paraphrasing here, but he said, effective treatment does one of two things. It either stimulates the body's natural functions or it eliminates something that's hindering the body's natural function. So with an anti-inflammatory, we are eliminating inflammation. We are not eliminating something that's preventing the body's natural function. We're actually eliminating a natural function. We need that function to occur in order to get true long-term healing. And so I'm not here to tell you should never do an anti-inflammatory. I am here to tell you that we are over-dependent upon them. And I do believe strongly that it has done more harm than good when it comes to healing. The thing that you do to eliminate the inflammation might make you feel better, but that what you're feeling is fool's gold. If the tissue can't get the nutrients it needs, we have some troubles. Now, I want you to meet my friend Andrew. This is a real guy. He's a physical therapist in Michigan. I've gotten to know Andrew over the last 15 years. Before I knew Andrew, Andrew was leaving college and preparing to start physical therapy school. But in that interim period between those times, he got a really bad back condition. He was just age 24 at the time, and he did what almost everyone does. He tried to ignore it. He couldn't for very long. It got really bad. So he went and saw the doctor. The doctor gave him some anti-inflammatories. He took them and he felt a little bit better, but not a lot better. And it got worse. And then he had an MRI. He found he had a bulging disc. They did an injection, an epidural steroid injection. That helped for more than the medications did, but it got worse again. For a while, he was taking narcotics. His wife would lay in bed with him, listening to him breathe. Narcotics, opiates, what they do is they suppress the respiratory system. And she had to shake him to make sure he would not stop breathing. She was scared for his life. And I don't have a whole lot of time to belabor this point, but we've lost way too many people to accidental opiate deaths. And I'm on a mission to stop that, because opiates do not get to the root of the problem, and they are more risk than they are reward. We need to find and fix the root of the issue. And so Andrew actually didn't figure out the root of his problem from anyone until he got to PT school himself. And so I'll give you some details right now. They were just doing some routine range of motion assessment, and they found out that his hips that are supposed to rotate a lot don't rotate. They didn't rotate the way they were supposed to. And you think about what happens when we walk. Plant your foot, move ahead. Plant that foot, move ahead. There's a lot of rotation that's happening in the ball and socket joint of the hip. He couldn't rotate well in one particular direction in his hips. And guess who had to pay the price for that? That stress went to a close neighbor that went to his lower back. And so until he made his hips do what his hips were designed to do, but were not currently capable of doing, that poor movement, that dysfunction that he had in the way he moved his hips, resulted in physical mechanical stressors that resulted in a disc issue. And fixing the disc didn't fix the movement issue. The movement issue is what fixed the problem. Now, I want you to understand what we were just talking about a little bit there was how the hip moves. Every body moves three-dimensionally. Every body part, every joint moves three-dimensionally. So let's talk about your spine. Your spine is made to rotate, okay? But not much in the lumbar spine. The lumbar spine only rotates about 5 degrees in each direction. So it is not made to rotate at the lower back. There's side-to-side movement as well at our spine. We have a little bit more side-to-side movement, about 20 degrees in each direction at the lumbar or lower back area. You can see there the sagittal plane, flexion and extension. We do a lot of movement in that sagittal plane. We have about 70 degrees of total motion between flexion and extension at the lumbar spine. So we need to understand that. Every body part needs to be able to move well and have a balance between mobility and stability. If we have too much mobility and not enough stability at a particular joint, that's dysfunctional, and it will have cumulative consequences. If we have too much stability and not enough mobility, that is dysfunctional as well, and that too will lead to accommodations and compensations that have an accumulative effect on the human body, usually not at that part, usually at the closest neighbors. So let's talk first about the most common types of lower back pain. And first I want to talk about sciatica. I'm sure that you've heard that word before. The sciatic nerve is the biggest, thickest, longest nerve in the human body. It is formed from spinal nerve roots that exit the lower lumbar and upper sacral spine, and they bring motor information to all the muscles of your lower leg. So it's because of those muscles function, or those nerves function, that we can stimulate muscles to contract, to use those muscles. This nerve also receives and brings back to the spinal cord, and ultimately all the way up to your brain, sensory information as well. And then your brain has to translate what sensory information it receives from all your nerves, including that sciatic nerve. Now, if you have symptoms that go down your leg, particularly the posterior leg, it is possible that you've irritated your sciatic nerve. There was a study done, I'm trying to remember, I think it was in the 1960s, kind of a weird study. The subjects were placed on a gurney on their side, I believe, and they were not put to sleep, but they were locally numbed at the spine, and they made a little cut, introduced a tool, and started pushing around different spine areas and the lumbar spine. And they found that you could push on some facet joints and some ligaments, and that would cause referred pain. And that referred pain would go into the butt, it would go into the posterior leg, but only in the upper leg. The only way to get symptoms to go down to the knee and below was to actually push on some of those nerve roots. And so if you get symptoms into your buttock or even into the upper leg, oftentimes people are going to say, well, I have sciatic nerve issues. Maybe not. It might just be referred pain from the local spine-related problems. But if you get symptoms, pain, numbness, and tingling that goes beyond that into the calf, you definitely have an irritation of the sciatic nerve. Now, you could have an irritation of the nerve root components that feed and make up that sciatic nerve. That's called a central problem because it's happening centrally at the spine. There are other things that can put pressure on your nerve as well, but not centrally, more peripherally. So central irritations are lumbar spine issues. But if you get pressure from something external to the spine, and for example, this piriformis muscle in your glute, that's really not even a lumbar spine issue. That's another issue, but people do believe that's a sciatic nerve issue coming from the spine itself. Now, what are the most common types of lower back pain? Well, let's talk about the big three. We're going to talk about herniated discs. We're going to talk about sacroiliac joint issues. And we're going to talk about stenosis. I want you to understand, when we talk about these diagnoses, I'm not really at all talking about what the cause is. I'm just describing them to you. Okay, it's more of a definition and an explanation. It is not cause that we're talking about. Now, if you get a herniated disc, I'll tell you this first and foremost, you're probably younger. Okay, so in a normal disc, we've got outer layers of fibrous tissues, and then the inner layer is a little more, the inner layers are a little more mobile, fluidy. And so what tends to happen, we don't see it well in this picture, but the fibrous rings are denser, thicker on the front, and they're narrower and thinner on the back. Now, straight on the back side, that's right where our spinal canal is, and we've got a thick ligament in there. So we almost, it's pretty rare to have herniations that go directly to the backside. Herniations are almost always back and to the right or back and to the left, and that's what we're seeing over here. There's been progressive damage to the fibers on the outer rings, and that disc material is leaking out a little bit, and that nerve root is compromised. That's in a position where it's more likely to get pinched. And people that experience that will say, bending forward makes it hurt worse. Straightening up makes it feel a little bit better. Laying down is a lot better than standing or sitting. Coughing, sneezing can cause sudden shooting pains, numbness, and tingling down the leg from the pressure that puts on the pinched nerve itself. Now, we don't like to experience pain, numbness, and tingling, but I want you to be aware that those are sensory experiences. And though it's really uncomfortable, it's not dangerous to have sensory experiences. It gets to be more dangerous if you start to have motor changes, changes in your muscle function. And where this usually occurs, it's more likely to cause things like a foot drop. People can't lift their toes as well if they have significant pressure on those lumbar and sacral nerve roots. And if it's a little bit lower, you can have difficulties controlling your bowel and your bladder too. So if you notice foot drop, bowel and bladder changes, you need emergency care for those kind of things. If it's just sensory stuff, pain, numbness, and tingling, that's not emergency related stuff. And there are ways to remove the physical pressure on that area for many people. The L4-5 segment, not the very lowest, but the second to the lowest is the most common level. And here's good news. 85% of people that deal with these numbness and tingling and pain issues are going to get better at some point in time. And most of the time it doesn't take this long, but 85% get better within 6 months. The interesting thing is the same research shows that only 50% got better with surgery. And I would argue that's because you might have gotten rid of some of the evidence of the movement issue. But if you haven't gotten rid of the movement issue, the same stressors are going to apply and continue to stress that tissue. Let's move our focus for a moment to the sacroiliac joint, SI joint. So we talked about the lumbar spine. The low back has 5 segments that meet against this sacrum. That's right here. The sacrum are several segments that are fused together in the normal person. And that sacrum is what connects directly to our pelvis, right pelvis and left pelvis, as we look at this here. And it's the ilium, those little things that look like elephant ears, the things that we can put our hands on when we hold our hips. That's actually the rim of our pelvis, and it's the ilium. So your sacroiliac joint is really the joint that connects your sacrum to the ilium. And you can see there, it's a big joint. And this is the confluence of everything from the upper body being transferred down to the lower body. It's a major joint. It has lots of thick ligaments there that you can't see very well, which result in it being pretty stable and secure. There's some movement there for sure, but we don't want a lot of movement there. If there's more movement there, if it gets unstable, that's problematic. Now, people with SI joint issue will almost always say this: it's going to hurt low and to the right or low and to the left, kind of where the dimple is in your low back buttock area. Most of the time, it's one of those dimples, not on both of those dimples. People will tell me that transitional movements hurt, like moving from sitting to standing or standing to sitting or turning in bed, those kind of things. Sometimes it does wrap around the lateral leg and into the front of the thigh a little bit too. That's going to occur to people of all ages. It's a little bit more common with women, especially during and after pregnancy. If you think about the growth of the baby in the womb and what mechanical impact that has, it drops the pelvis down and forward and just kind of torques that area a little bit. Plus, especially towards the end of the pregnancy, the hormones are changing to prepare for the opening of the pelvis to allow that baby to pass through. And that means that there's less stability during that time than under normal circumstances. The ultimate result is if you have a joint that's not supposed to move, it takes on a lot of movement forces and it moves a little bit more. There's mechanical pressures, which creates friction, inflammation, pressure on the nerves, not necessarily the nerve roots, but just sensory nerves in that area, and that makes us feel pain. This can occur insidiously, not really any cause to it, but sometimes if you fall and land directly on your bottom, you can physically twist that a little bit or stress those supportive ligaments around that area too. That's a real issue, but it's a very fixable issue too. Maybe you don't commonly hear the word stenosis, but stenosis is the most common kind of lower back pain. And probably the more common phrase is arthritis. Some other words or phrases that are often associated with stenosis or arthritis are degenerative disc disease, DDD, or disc degeneration, bone spurs, osteophytes, easily the most common kind of back pain. And if you have been told in the past that you have a slip disc or a herniated disc or a bulging disc, but now you're 55 years old, you probably don't have a bulging disc anymore. You just have arthritic changes that have occurred over time. Now, you don't need an expensive diagnostic test to figure this out. If you're over 50, if you hurt more with upright stance or walking, and then you hurt a little bit less with sitting, it's like 97% likely that you have arthritic-related back pain. So that's pretty easy to diagnose. Here's an artist's rendering. This is a side view of two lumbar segments. You can see how one lumbar segment creates a little opening that's met with the other one from below. That's that little neural foramen through which the nerve root passes. It normally wouldn't be red, but it makes it easier to see. The artist put all this red in there to highlight the changes that are occurring to the edges of the vertebra, to the edges of your transverse process right in that area. There's a certain amount of space that exists for that nerve to exit, but over time, because of the growth of these bone spurs, stuff can start to impinge upon that space and pinch that nerve. And when that nerve gets mechanically pinched enough, it can get irritated such that the nerve takes up a little bit more space because it swells a little bit too, which means it's more likely to get pinched, which leads to this downward spiral. More pinch, more pain, more changes, more pinch, more pain, more changes, poor movement, and that's a problem, okay? But I want you to understand this, and I'm guessing that several of you have already had some type of a diagnostic test, and if you've done that and you've had pain, you probably found something on that diagnostic test. What this chart is showing to you is, I hope, it is hope that you're going to get from it. These are people, these are what we find in the backs of people who have no back pain. They are asymptomatic, no symptoms, okay? And then we got the different age categories. Disc degeneration exists in 37% of 20-year-olds that have no back pain. And you can see over time it becomes more prevalent over age, but all these people, regardless of their age, don't have back pain, okay? Even with a disc bulge, you can have those things, and a lot of them don't have any back pain. So I want you to understand this. The presence of a pathology, even if it's seen on an objective diagnostic test like an MRI or an X-ray, we prefer not to have those things, but part of that's just normal. And pathology does not necessarily correlate with pain. The reason I'm telling you that is because lots of people have a pain. That's when they get the picture taken. They find a pathology, and they put two and two together and say, if we get rid of that pathology, I'm going to feel better. I need a surgery. Okay. Unfortunately, pathology does not necessarily directly correlate with pain. And there's been a lot of people who've had surgeries as a result of finding a pathology. But remember, this is not as much a medical issue as it is a mechanical movement-based issue. If you fix or clean up the structure, but have not fixed or cleaned up the movement, the mechanical stress will still be there. And it's likely that your pain is going to be there too. Maybe not immediately, but it will often return. So we need to know what's truly causing this, because unless you find and fix the root cause, the root movement-based issue, the tissue is going to continue to cry out for help. So let me give you another analogy here before we finish this up. I'm sure most of you have seen or have been in a manufacturing environment. Think about an assembly line. And there's a product coming down the assembly line. Let's say it's an air conditioner. And there are three people. Person A does a little something, person B does a little something, person C does a little something, and keeps going. They're sharing the work. Little A, little B, little C, little A, little B, little C. They're each doing about a third of the work. That's the way it's supposed to go. What would happen if person B said, nope, I'm not going to do it? Person A has to pick up the slack, and person C has to pick up the slack, and they're going to work harder because person B has decided, I'm going to be lazy. They're being dysfunctional, okay? So if I was the supervisor and I could tell A is hurting and C is hurting, they're working hard, they're not happy, and I told them, you know what, you look like you could use a little back rub. Maybe if I just give you a little medication, would that be better? Would that make you feel better, wouldn't it? I'm being a little bit facetious, but the point is this. If I could truly talk to that person and say, do you want to have a back rub? They might say, you know, that might feel a little bit better, but ultimately, B's the problem. If B did his work, I'd be better off. I wouldn't have to do so much, okay? We need to find B. And your back, we need to find B. Because your back, which might be person A, is suffering because of what B is not doing. So I said this a little bit ago, this balance between mobility and stability. We need to land somewhere in the middle. So we use this weird word called mostability, the combination of mobility and stability. I talk a lot about Goldilocks, and I think that fairy tale is kind of interesting because Goldilocks understood she didn't want the hard bed, she didn't want the soft bed, she wanted just right. She didn't want the porridge to be hot or cold. She wanted just right. Your joints are like Goldilocks. Not too much stability, not too much mobility. Most stability is the just right. And when a tissue is not just right, when it's too hot or too cold, too mobile or too stable, then other things experience mechanical stresses due to compensations. Finding and fixing the culprit is the key. And here are the top 3 culprits. You already know from my friend Andrew that the hips are an issue. And by the way, these are big issues, okay? But we're also going to go just above the lower back to the mid to upper back. How well does it move? Is there a dysfunction there? Because if your mid back doesn't work well, the closest neighbors are going to be at risk. That's your low back and your neck, okay? What about your feet? That's an interesting one. That's not the closest neighbor. But when your foot hits the ground, it leads to a chain reaction up your movement system. And I've had lots of people who dysfunctionally move through their feet, which leads to compensations up the movement chain. Let's briefly talk about your hips. What we're seeing right here is nothing but your skeleton and a certain muscle group known as your hip flexors. This person is standing, and you can see how long and almost wavy, angled those muscles are. Now think about how we work today compared to a few generations ago. A few generations ago, people were in agriculture, okay? So they were on their feet, they were doing work, they were moving. But with the evolution of time and all the ergonomic advancements, that technological advancements we make, a lot of people now sit regularly, or pretty sedentary. Aside from other things with regard to our general health, in sitting, we're in this flexed hip position. Instead of our knees being below our hips, they're in front of our hips. And so these muscles now are not on length as much as they used to be. They're often shortened because of the position of the hips. And over time, we become what we do. And what happens if those hip flexor muscles get tight? As soon as we stand back up, it's going to impact the pulling on different bones in the body. Either that's going to pull your pelvis forward due to the connection there at number 3, or it's going to pull your low back forward, the lumbar spine forward, because the connection's through number 1 and number 2 in that area. In some cases, it's going to do both, and that's problematic. If those hips are pulled forward, it's going to put more spinal pressure on some of those joints in the back of the spine. Okay. And then just remember what I told you, your hip, like everything else, is a 3-dimensional being. It flexes and extends, it side bends left and right, it rotates left and right. And if we get tight, either because of this muscle or other muscles or the hip joint capsule, and it can't do what it's designed to do, the movement stresses get sent elsewhere. And the close neighbors are at fault. So if you had knee issues and low back issues, it is highly likely you have a hip joint dysfunction. If it is too mobile and not stable enough, it needs to be stabilized. If it's too stable and not mobile enough, it needs to be mobilized. If you have not had your hips assessed and you've got a history of lower back problems, that is a big rock that needs to be checked. What about the mid to upper back? Okay, now, granted, the thoracic spine does not move near as much as the cervical spine or the neck area up above it. It doesn't even move as much as the lumbar spine below it, but move it must. The thoracic spine has the rib cage that connects to it, so it kind of cages everything in. Do this if you would for me, okay? I want you to slouch, really bad posture. Just let it slouch for a second. Now, when you stay slouched, now try to rotate to the right as far as you can and try to rotate to the left as far as you can. You're going to find it's really hard to rotate when you are flexed. Now, sit up tall and try the same thing. And notice how that frees up another plane of movement. When you lack movement in one plane, it has a negative effect on movements in the other planes. And so the thoracic spine for many people tends to round over time. Gravity begins to win out. When it rounds, we lack rotation. When we do something simple like walking, there's a transfer of energy from the upper body to the lower body that occurs because we are rotating the thoracic spine. And that rotation naturally creates action and stabilization from these core muscles on the front and the back side of the spine. A poorly moving thoracic spine is a major cause, root cause of lower back issues and of neck issues. You need to understand those things. The foot is another issue too. You can see on this left side, if this foot pronates too much, it's going to change angles and forces at the knee, at the hip, at the low back, at the mid back, at the shoulder, at the neck. It has an influence all the way up the spine. And there are some people that just need to have better stability or through their foot because they have way too much movement, while others have way too stiff of a foot, and that needs to be mobilized so it can help cue the responding chain of events up the lumbar spine. Now, I'll tell you this, a lot of the people, a majority of the people that I see that have poor foot function, if I look and see why that occurs, it's oftentimes because of the hip as well. So that could still be at its root a hip-related issue. The bottom line is this: if you've got lower back pain issues and you've only gotten treatments that focused on the lower back, whether that be manipulations, massages, electrical stimulation, ultrasound, medications, injections, surgeries, and you haven't looked at the entire environment, like at the community, and especially at the closest neighbors, if you haven't looked at the hips below and the thoracic spine above, and you haven't gone all the way down to the feet to make sure that you've got a function and not a dysfunction, a downstream mobility and stability to all those parts, it's really likely that your lumbar spine is suffering mechanical stress because of another or multiple other problems. Tissues are designed to handle some stress. The problem is when we demand more of those tissues over time that we start to have issues. So it's a little bit oversimplified, but imagine having a poorly aligned tire. Okay, that poorly aligned tire is not a problem if the car is parked on your driveway. It doesn't become a problem until you get out and you get on the road and you move and move and move and move and move and move, and eventually a predictable wear and tear pattern that's different on that tire is going to be noticed. Okay, so what we're doing to that tire is asking to do things it wasn't designed to do. The stress is not balanced on that tire, and there's an imbalanced damage that occurs gradually and progressively, cumulatively over time. So you're not going to be surprised to hear me say that successful treatment of lower back pain means you got to eliminate the root cause of the issues. And I'm here to tell you that the most common treatments do not get to the root of the problems. Medications, injections, and surgeries only mask the problem. Okay, just because they're the most common treatments doesn't mean they're most effective. We need to do a root cause analysis. That means we need to look at you as an individual, and we need to get beyond just looking at the back itself. We need to have a whole body, more global approach. The entire global movement system needs to be assessed. How does the ankle talk to the knee, and how does the knee talk to the hip, and the hip to the back, and the back to the thoracic spine, to the shoulder blade, to your shoulder, to your neck? All of that needs to be assessed. We need to make sure there's a functional balance of movement and stability at all those parts. And if there's not, you need to go through that process, a process that's educational and empowering. There's the right thing to do today, which leads to the right thing to do tomorrow and a different thing the next day. So it changes. You're empowered to know how to do the right thing at the right time to get the right impact. It's legal for us to work with multiple people at the same time. It's called group therapy. I'm here to tell you that you should never get group therapy for back pain because you need an individualized approach that requires one-on-one assessment. The first day is an evaluation, but every day is an evaluation of how you're moving and what needs to be done to bring you back to this balance stream mobility and stability. It's okay to use hands-on treatments. We do a lot of those things, but that hands-on needs to be combined with real and functional movements between gravity and the ground. It needs to be combined with movement and exercises. Remember early on when I told you acute trauma followed by time is different than this cumulative trauma that builds over time. What we're trying to do with your cumulative trauma, if we find and fix the root of the problem and take stress off that tissue that's crying out for help, is as soon as we get to that symptom or threshold, you feel it, we do something to take stress off that tissue. And when the tissue doesn't have the stress, the tissue improves, and we can get below that symptom threshold and act and behave much more comfortably. Now, I'm not here to tell you that by doing the right things means you have a 100% chance of being painless, pain-free in this. We think about your reality as being how much is your pain and how good is your function. And when we're young and capable, we have great function and we have really low pain. And what happens with cumulative trauma is those two elevators are moving in the opposite direction. The pain gets worse and the function reduces. Okay. And so I can't tell you we can make you painless, but I can tell you if we take the physical stress off that tissue, the mechanical stress off that tissue, we can reduce pain frequency and duration, and we can enhance your function. That is a solution that works. And that's the only solution that's going to work over time. Now, I hope that you've been nodding your head quite a bit today. I'm sure you've learned a few things. It's really not earth-shattering stuff. It's pretty common sense. But when you understand it's a mechanical issue as opposed to a medical issue, you shine light on some things. Now, we maybe have solved some problems. We haven't solved all the world's problems here yet. First of all, your memories are limited. You're not going to capture all this stuff. Probably even more importantly, though we've talked about what the primary true culprits are, the roots of the problem, it's impossible in this format for you to understand what your problem is. And we like to say that knowledge is power, but I'm here to say knowledge is only powerful if we can put it into action, if we can implement it. And so for you giving me some time here tonight, I'm going to offer for you a gift, and it is free with no strings attached. I'm going to offer you a natural lower back pain relief consultation. And I'm here to tell you that with a brief screen that takes only about 20 minutes, we can easily do some things to tell you very quickly what type of back pain you're having, what the most common, most likely root causes are for that back pain in your life, and then what a process to make it better would look like. And ultimately, we want you to gain confidence, direction, and hope when we do this too. I've told you that I've been around long enough to understand that there have been a lot of people spending a lot of time, energy, and money on things that don't get to the root of the problem. So I'm trying to encourage you to stop wasting time and money to get to the root of the issue and take control of it. Do it all naturally without the need for injections, medications, surgeries, avoiding high-risk procedures, all those side effects, and ultimately to become less dependent upon others and more dependent upon yourself. We could only do that if we could implement and find unique solutions to your unique issues. This does have a value. The time that we would give you actually in the open market is about $150. I'm not going to charge you that. It's absolutely free for you to do this. And I'm going to give you a guarantee. I can't give you a money back guarantee because I'm not making you give me any money. But I will tell you this, if you choose to do this screen and you say, well, that was a total waste of my time, just tell us that. And I'm going to give you $150 to give to whatever charity, or we'll give it to whatever charity that you want us to. We love supporting local businesses like us, exist to transform lives and restore hope. I'm actually really proud to say we've never had anyone take us up on this because it is really valuable. You're going to know what the root cause is. You're going to know what the process to get better would look like over time. And if you get nothing else, you're at least going to get some knowledge, and you can take home your little consultation sheet with you, and you can decide upon that time what to do about it. So I'm going to ask you to do this. You can, that's a QR code. If you want to scan that, you can. Probably the simplest thing to do is if you want to have a free injury screen, spending 20 minutes with one of our low back pain specialists, just do this. Click on that chat box again, and I want you to say, I'm in. I want to do it. And then we need to also know where you want to do it. So listen to me here. Here's the clinic options for you. You can do it. I'm going to start from the north and go to the south. You can do it in Ames, Des Moines, Colfax, Newton, Pella, Oskaloosa, Albia, or Centerville, whichever clinic is closest to you. So I'll say it again. If you want to do it, say I'm in, and you tell me if it's Ames, Des Moines, Colfax, Newton, Oskaloosa, Pella, Centerville, or Albia. Those are our 8 clinic locations. We can also do it online too. So if it's not the most convenient thing for you. If you're too far away, we can set up an online format for this as well. And I promised that I would give you my direct contact information. So there it is. That's the phone number that will get directly to me. This is the email address that gets directly to me too. I welcome any of your questions. If you want to reach out with those things, that would be excellent. You've been getting some emails after you register for this. If you reply to those emails, that will get to me eventually too. In fact, you're going to get another email, if not tonight, first thing tomorrow morning. And on that email, you'll get a link to watch this video, so you can do that. I'm going to ask a favor for you. If you know other people that are dealing with low back pain, send them that link. If they want to watch this too, we're going to offer them the same free screen. Because we want to reach more people. Here's the statistics. In America right now, 54% of adults are dealing with musculoskeletal issues. Only about 8 or 9% of them get to the movement expert that can help them. That needs to change. We need to stop doing the stupid things that don't really get to the root of the problem. And I want you to have options to do that. I want your friends to have an option to do that as well. On that same email that I send to you, there might be a sign up for a free screen form on there too. But if you've already given me your name on here, let me take a look at this. I got some chats coming in. So let's see. Kim, you want to be seen in Pella? Great. We'll do that, Kim. Jerry, you want to be seen in Ames? We'll get you signed up. I'll have our care coordinators call you tomorrow for that. Jenna, you want to be seen in Oskaloosa? Good. Keep sending in, guys, if you want to do that. And at the very least, I want to be a resource for you. If you have questions that need answers, just reach out to me. That's what we want to be here for. At some point in time, if it's right for you, we're here to serve you in that right time. Patricia, thanks. Raise your hand. I see ya. Dad Min, thanks to you too. If you need anything, let me know. Otherwise, I look forward to helping you with your back pain at your earliest possible convenience. Thanks a lot for your time tonight. Bless your time here, and blessed to have you here. Take care.